Hello friends, I hope you all will be fine and doing good. Today we are going to discuss about anxiety. What does anxiety mean? Because by anxiety many people lives are affected, but many people deals with it, many people handles it. What does it actually mean? Anxiety is a feeling of unease like worry or fear that can be severe. Everyone has a feeling of anxiety at some point in their life. For example, you may feel worried or anxious about sitting in medical test for an interview or sitting in any exam during time. It can be perfectly normal, but some people hard to control their worries. Their feelings of anxiety are more constant and can often affect their daily lives. Like at the start I said to you that it affects many people lives. They can't handle it, they are unable to handle it. It takes a year to take out themselves from anxiety. If we see the second definition of anxiety, an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. And it's a normal reaction to stress and can be beneficial in some situation. Anxiety is also beneficial in some situation. It can alert us to danger and help us prepare and pay attention. It differs from normal feelings of nervousness or anxiousness and involve excessive fear or anxiety. Do you know it affects 30% of adults at some point in their lives? But anxiety disorders are treatable. Are female are more likely than men to experience anxiety disorder. Means female are more affected by anxiety instead of men. But if we talk about symptoms of anxiety, there are many symptoms. Let's discuss it one by one. The first one, the main symptom is excessive fear and worry. And there will be a panic, fear, uneasiness, feelings of panic, doom or danger, sleep problems, not being able to stay calm and still, cold, sweaty, numb or tingling hands or feet, shortness of breath, hyperventilation. Hyperventilation means breathing faster and more quickly than normal. Heart palpitations means rapid, strong or irregular heartbeat. Dry mouth, tense muscles, dizziness, thinking about a problem over and over again and unable to stop means rumination. Inability to concentrate intensely or obsessively, avoiding feared object or places. So these all were the symptoms of anxiety. And if we talk about the causes of anxiety, what are the causes of anxiety? Why it happens? The first one, genetics. It can run in families. And the second point is brain chemistry. Some research suggests anxiety disorder may be linked to faulty circuits in the brain but that control fear and emotions. The third point, environmental stress. Environmental stress is also the cause of anxiety, like stressful events you have seen or lived through, like childhood abuse, neglect, death may be used to hide, or of your loved one, like your loved one death, being attacked or saying violence. The fourth point, drug withdrawal or misuse. Certain drugs may be used to hide or decrease certain anxiety symptoms like alcohol, etc. Medical conditions. Some heart, lung, and thyroid conditions can cause symptoms similar to anxiety disorders or make anxiety symptoms worse. And history of mental health disorder. Having another mental health disorder like depression raises your risk for anxiety disorder. Depression is also the cause of anxiety. And the sixth point, childhood sexual abuse. Emotional, physical, sexual abuse or neglect during childhood is linked to anxiety. Means if we are neglected at the childhood, then it also leads to anxiety. And these all are the disorders in later life. Trauma. The seventh point is trauma. Living through a traumatic event increase the risk of post-traumatic stress disorder, which is also called PTSD, which can cause panic attacks. And the eighth point, negative life events. Stressful or negative life events like losing parent in early childhood. Losing parent in early childhood is also the cause of anxiety, which we feel in our adulthood. And the last point, severe illness or chronic health condition. Constant worry about your health or health of a loved one or caring someone who is sick. Substance abuse, the use of alcohol and illegal drugs makes you more likely to get an anxiety disorder. Some people also use these substances to hide or ease anxiety symptoms. And the last point, being shy as a child. Shyness and withdrawal from unfamiliar people and places during childhood is linked to social anxiety in terms and adultery. Low self esteem, negative perception about yourself may lead to social anxiety disorder. So this was about topic of anxiety. If you have liked this video, do subscribe channel for the latest videos about English and about other interesting subjects. Meanwhile, I have made video about depression and types of depression. If you want to study that topic as well, the link is in the description. You can watch that videos as well. Thanks for watching. Take care of yourself. Allah Hafiz.